Hello, welcome to my presentation for Capstone 3, titled Incarcerated Pregnant Women, the Need for Proper Nutrition and Education, presented by Dara Jefferson. During Capstone 2, others in my group were Haley Bruce, Christina Hatler, and Mariah Nutter, Arizona State University. In this presentation, I will discuss the need for proper nutrition and education of incarcerated pregnant women. A quick summary. Research indicates that women who are pregnant at the time of incarceration are faced with difficult choices, such as adoption of their child upon birth or termination of their pregnancy. Incarcerated pregnant women are also faced with below standard prenatal care, with the needs seen in numerous areas, including nutrition, medical care, and education on healthy pregnancies. A drastic rise of incarcerated women was seen beginning in the 1980s. In fact, the rate of incarcerated women was growing faster than that of incarcerated men. In 1986, the number of incarcerated women rested around 19,000. In 1999, there were 43,845 women incarcerated in state or federal prisons in the United States. By 2009, that number has risen to over 115,000. Currently, on any given day, about 250,000 women and adolescent girls are behind bars, including in jail or in prison. 3 to 4% of women are pregnant upon intake into the correctional system nationwide. As many as 10,000 may be pregnant. The number of women in prison has grown by over 800% in the past 3 decades. Nearly 2/3 of women in prison are mothers. Because the correctional healthcare system was established to serve a predominantly male population, healthcare in most correctional settings falls short of meeting the basic needs of women. The influx of women entering the prison system and into existing facilities cause strain on the system. Women have a myriad of physical differences than men that when incarcerated, the correctional system is now required to care for. For example, premenstrual syndrome, menstruation, and providing sanitary items to handle these natural parts of being a woman. Women are more likely than men to seek psychiatric treatment and more likely to be diagnosed and medicated for depression, anxiety, and post-traumatic stress disorder, also known as PTSD. The correctional system is then responsible for not only paying for the inmates' medications, but also continued psychiatric care and the administration of the medication. In addition to what I have already stated, women may also have the need for prenatal care and education. Along with the increase of incarcerated women became a change in demands. Historically, the needs of incarcerated women and their families have not been a high priority. Pregnancies of incarcerated women are often high risk due to poor nutrition and limited access to prenatal care. Several programs have been put in place to address the problem with the lack of education and nutrition for pregnant inmates. However, they are not as effective as promised. According to the National Women's Law Center, 38 states fail to follow or have proper procedures and policies regarding appropriate prenatal care. Additionally, 34 to 49 states lacked required medical examinations, lacked prenatal nutrition education, or provided inadequate prenatal education. The initial research for this presentation looked specifically into policies for women in the Arizona Department of Corrections. After researching online, it was found that there are no policies addressing prenatal care or education for pregnant incarcerated women available for public review from Arizona Department of Corrections, although there are policies regarding health care of inmates available. As I've stated before, the Bureau of Justice Statistics estimated that between 3% and 4% of imprisoned women in the United States are pregnant at the time of admission. However, in such places as New York City, that number may jump as high as 30%. Along with a significant increase in the female offender population comes an increase in the number of children who have a mother serving time in a correctional facility. In fact, approximately 75% of these women are mothers of minor children, leaving about 200,000 children motherless. Although the Eighth Amendment to the U.S. Constitution protects inmates' rights to health care, there are no federal regulations on the minimum standards for nutrition in state prisons. Pregnant inmates present unique challenges for correctional health providers, including meeting the nutritional needs for healthy pregnancy outcomes. Specific guidelines are set by the U.S. Department of Health and Human Services for pregnant women. Pregnant inmates depend on correctional authorities for their health care, and correctional authorities are legally obligated to meet their needs. Whether an incarcerated woman decides to continue her pregnancy to term or terminate her pregnancy, she has a constitutionally protected right to obtain appropriate and adequate medical care. The standards, which come from the National Commission on Correctional Health Care, the American Congress of Obstetricians and Gynecologists, and the American Public Health Association, specifically address the care and treatment of pregnant inmates. The majority of state prisons receive failing grades for prenatal nutrition and education policies. Arizona is failing. Although no policies addressing prenatal care or education for pregnant incarcerated women were found, it is known that the Arizona Department of Corrections received an F for their prenatal nutrition and education. According to the policies of the Arizona Department of Corrections, they require inmates to be provided opportunities for reasonable and appropriate access to medical, mental health, and dental health care at reasonable fees. In Arizona, complaints about prison medical care regarding pregnant inmates prompted the ACLU and the Prison Law Office to file a class action lawsuit in 2012. Because Arizona is failing, a good place to start would be to create policies that adhere to the basic level of care as outlined by the Department of Health and Human Services. Policies and procedures should comply with standards of care of pregnant women set by the National Commission of Correctional Health Care. Nutrition guidelines for pregnant women are particularly important in corrections environments where the facility controls the availability, type, portion, timing, and quality of food. A correctional system's success or failure to address the nutritional needs of a pregnant woman may have short and long-term implications for women's health and that of their child. Next, because early identification is key to initiating prenatal care and changes in lifestyle that would promote a healthy pregnancy outcome, it is recommended that correctional facilities routinely test all women of reproductive age for pregnancy at the time of admission to the facility. Following the results of the pregnancy test, a proper education and nutrition plan should be put in place for each individual inmate by a licensed medical professional. Lastly, it is suggested that all correctional facilities hire an outside program or facilitator that would come in and teach a class several times a week for pregnant inmates and those who are mothers. Classes would focus on providing up-to-date information, proper education and nutrition guides, and facilities will ensure all mothers and pregnant inmates can attend at least, but not limited to, one class. This would benefit both the incarcerated mothers and the children and families they return to upon their release from prison. In summary, we believe it is imperative to change the Arizona prison systems to be better suited for women. Medical care for women should include, but not be limited to, prenatal care, which would include education and nutrition, menstrual care, and mental health. We also believe that Arizona should have better resources regarding pregnant women open for public review. With the rise of pregnant incarcerated women, the need for updated programs is tremendous. Without proper prenatal nutrition and education, unborn babies and their mothers are at risk of unhealthy pregnancies, which can be detrimental to both. Prior to incarceration, pregnancies are compromised by variable prenatal care, poor nutrition, domestic violence, and illicit drug and alcohol abuse. It is then ironic that intra-institutional prenatal care is often superior to what is available prior to incarceration. It is for this reason that the U.S. prison system, along with the Arizona Department of Corrections, their medical staff, and voters should advocate for changes that would benefit incarcerated pregnant women. The Arizona Department of Corrections can make positive changes now that will improve the health of the woman and child for years to come. Good nutrition promotes healthy pregnancy outcomes. Thank you for listening to my presentation. I hope you found it both interesting and informative. My motivation for joining this group during Capstone 2 was to learn about something new. I hope you are able to too. A couple of discussion questions that you can think about. So there are numerous issues to consider in addition to nutrition when it comes to incarcerated pregnant women. What are some things that you can think of that the United States can do to improve care for such patients? Also, in what ways can the United States prison system better support mothers in prison in order to reduce recidivism? Or do you even think that this is a responsibility of the prison system?